this session, we basically want to go over a couple things, just some things about how to navigate the schedule and being comfortable in the schedule, the different views that there are, and how to read some things, how to start a charting note and an assessment note, and charting between disciplines, and then also how to use some reports to find past charting notes to see which ones are still incomplete. So that's everything that we want to cover. We're going to get started now just because it might, I think we're going to use the whole half hour and someone's actually coming on right afterwards, so we're just going to go ahead and get started. So right now I'm in a live clinic. I'm at Trafalgar Physiotherapy in Ontario, and I just want to show you some things about the schedule that you're going to notice. So right now I'm in day view, so you can see that right here it says view day level of detail is default. So this is just my default one, that it's just the default view, so it basically allows you to see every provider in the schedule for that day, but it doesn't break it out if someone can see more than one patient or more than one patient at a time. You don't see both patients, so you see it based off of the loading bar in this view. So you can see here for this this therapist, this PSP, she has a loading bar here which shows half full, so she only has one patient booked. If you look down below a couple, you can see that the loading bar has a little 2 above it and it's full. So she can see 2 patients at a time, and right now her time is full. So I can see who the second patient is over here. If I click on the light bulb assist, I'll be able to see who the second patient is, and if I want to have that patient up top, if I click on the little eye symbol and move it here, then that patient is going to be the one on the top of the schedule there. So that's how to do some of the working in the day view, or in the default view. You can also go into the week view from that, so you can see for one provider at a time. So if you wanted to see that whole schedule for the week for that one provider, you can do that this way. So again, any provider that you want to look at for the week. So if you want to see all of your appointments for the week, just go into the week view up here and then click on your name from the top up there. So another thing that is kind of nice that you can see is on these days up here, you can see in brackets how many patients are booked in your schedule or booked in that provider's schedule. So on Wednesday, I can see Robert has 9 patients, and then today there's 3 booked, and tomorrow on Friday there's 2 booked. So that's the same with every provider. You can see how many patients there are booked. If someone cancels their appointment or reschedules it, that number is going to change to be 1 lower for whoever canceled. So you can see all of that here. You can see that in the day view as well for each individual provider. So 6, 3, 15, 29. So it's kind of nice just at a glance to see that. Another way that you can look at the schedule is if you just right-click anywhere on the schedule and go into capacity view, then it's going to show how many patients you can see at one time, and you don't need to click on the light bulb assist. You're going to see all 3 rows of patients that you can be working with. And you can also do that for a week view. So if you want to see what your whole schedule looks like for the week, you can do that here and see all of the patients for the week. And again, you have your numbers up here for what's available. So however you're most comfortable with looking at the schedule, there's also practitioner view as well. So that is so that you can have the patient file open here on the left-hand side and then just go through your days on the right-hand side. Now when you are in practitioner view, you only see the 1 column, so you will need to be clicking on the light bulb assist to see the multiple patients booked in there. But again, if you look at the load bar, this provider can see 3 patients at a time because he's PSP. So you can see here there's just 2 booked from that little 2, and the fact that the load bar is 2/3 full. And I don't see a 3 one as an example, but that's kind of how you can look at it there. Okay, so now we're just going to hop over into our test system so we can do some charting and show you how that works. So I'm actually going to pass it over to Paulette for a lot of this, and we're going to go back and forth for the 2 of us. So first of all, just to orient you guys again, we are in week view for Princess Tiana, who's our PT-PSP, and we're going to do some charting here. So it's best to chart directly from the schedule because then it's going to link with the appointment type that you have booked. So again, with this patient, I can see that it's fully booked, the load is fully booked because it's an assessment. An assessment takes up the whole time slot, and that's to prevent any overbooking. So it's worth more if you book an assessment, and if you book it properly with an assessment code. So if I click on the light bulb assist here, I can see that my code is PTPRAX, so it's my assessment code. So then it's going to be worth more load, I guess. So it's different from this one here, which is just the treatment, and it's only 1/3 full. So to go ahead and start your charting, you right-click on the appointment and go into the attachments window, or you can click on the light bulb assist and pick the little attachment icon here. So whichever way you like going into it more. Then you go under your PoC form entries, right-click and select Add. And we're selecting Add this time because it's our first visit for this patient. So it's automatically, based on the fact that an assessment has been selected, it's automatically selecting our subjective objective analysis treatments, or our 4 SOAP note, or our 4 assessment forms. So I'm going to go ahead and click OK, and then just pass it off to Paulette.
Hi everybody. So let's see, if I was in a clinic, what I would do at this point. So this was, I forget the name already, Lewis Alligator. I can't spell. And date of birth.
And to look up things like this, sorry, just if you start charting and you're like, oh, I don't know the patient's date of birth, so that's where it's going to be handy to look in practitioner view, so you can have the patient file open at the same time. So if you go ahead and start your note, realize that you're not in the view that you want to be, you can still get out of this page, click OK, and then it's going to save the note as being started, and it's going to save everything that you have already started. So I'm going to click OK, and now I can see that the note has been started but is incomplete from that status symbol. I'm going to close out of that, and then I'm just going to go into practitioner view here. And I'm going to make sure I have that patient open, so I'm going to go into my day and go into View Client folder just to make sure that we have Lewis open over here. So you can see that it says Lewis Alligator on the side here, and then under the PoC form entries, I can see that that note is there, and you can open it up from here. So just highlight all of the pages that you want to look at and select Edit, and that's going to open up the page, and then you can go over to the Profile tab so you can see what the date of birth is.
Perfect. Oh, it doesn't like the, I don't need to do that.
Yeah, so when you're typing in, it automatically types in the form that you're writing, so you don't need to put in the slashes. All you need to do is enter numbers, and that's fine.
And in the date of assessment box, if I hit the space bar, it's automatically going to put in today's date, which is handy. It automatically puts a check mark in this box that verbal consent was obtained to continue with the assessment, which is also helpful. Date of loss or injury depends on what the patient is coming for, whether this is applicable to them. If they have more chronic medical condition, then that may not be applicable, but if they've actually had a work injury, for example, then that might also be good. So I'm just going to pretend that on the 17th they had an injury. Provider name, I'm just going to put myself in. I'm not going to worry about my last name at this point, and I'm going to say who I am. So in this section, this is pretty typical compared to any assessment note that we've done previously. So current history is really just what the patient is telling me happened for this particular injury, and I've dated it, so something actually occurred. So let me just make something up here. Patient was walking, he tripped on his tail, went down on right arm. I'm picturing a tiny little alligator arm. Went down on right arm, pain in elbow, went to, I can't type, hospital, x-rays, clear. So that's just an example of what happened. Previous history, no past injuries, general health. If everything was good, obviously I could just put good. If they've had a history of hypertension, for example, I could put it in there, or previous MVA 2 years prior with a whiplash 2, for example. Anything that's pertinent to what I'm assessing. Primary concerns, so Lewis, let's say his primary concern is pain. If it was more of weakness, then obviously I would select that. Depends what he's coming for, but right now it's elbow pain, so I'm going to put that. Additional concerns, I don't have any in particular right now. In this section here, medical, if they've been my patient previously and I've reviewed the questionnaire and it's exactly the same, then I could check this off and say whatever's in the note or in the chart is already is still applicable. I could do that. If the patient has already filled out a questionnaire and everything is a no, I can check this box and then I can ignore the rest. If there's something specific that I want to bring to everyone's attention, for example, a pacemaker, then I can select that. And I would be okay just leaving the rest. You could select through no, but it will take more time. Once you get down here, there's some text box so that you can enter specifics. So let's say he has an allergy to sulfa drugs, just making that up. In terms of these two other boxes, I'm not...
If there's anything else.
Yeah, if there's something that's not listed here, then you could include it in and put the answer. Medications, whoops, I keep hitting buttons I'm not supposed to. ASA, if he's on aspirin, for example, you could indicate that there. He did have an x-ray and the findings were negative. I can't remember if I said right or left elbow, but I'm going to put left. And I think I just put cap lock on.
Paulette's using my computer, so she's not used to the
yes.
keyboard of it.
Sorry, I'm hitting all kinds of buttons that I don't normally. In terms of social history, obviously, as you would in any assessment, if there's something pertinent in their social history, likes to play tennis, let's say, for example. Not that an alligator can do that, but it's all right. It's not a work injury, so he's currently unemployed, so I'm not going to worry about that section. Screening questions, so again, if no is the answer for all of these, you're just going to check that box and then you can go past. If there is one that is a yes, for example, I'm trying to think of something that's relevant for him. Night pain, if he was a potential fracture, for example, maybe he would have some night pain. In his case, he doesn't. So I don't need to worry about that. But again, you're only checking off the stuff that is pertinent. Pain history, in his case, it was sudden onset. Right now, I would, he's telling me he's got a 5, but when it first happened, it was more like an 8. And it is, I'm going to say that he has intermittent pain, irritability medium, character can be sharp, again, can't type. AM status, I'm not going to worry about that section in this situation, so I can just continue. Again, not going to worry about morning stiffness. Eases, rest, aggravates, upper extremity use, disturbed sleep. I'm going to leave. Sleeping position, again, I'm going to leave. So at this point, I've already gone through the subjective section, and I'm going to hit. Do I need to hit OK before I flip over?
Yeah, if you hit OK, it's gonna close out the note. So you can hit OK at any time. If you're gonna be leaving your computer for any period of time, then you can hit OK so that it saves your note, so you can go back into it. If you're ready to keep going on to your next tab, though, you can continue going.
Okay, so I'm just going to head to the objective tab here, and it's already starting at the top. So elbow. I can't remember now if it was right or left at the beginning, but I'm going to put right. And he doesn't have any second, third, or fourth injuries. So observation, this is where you would put in, so AROM, full radial and ulnar I don't even know if alligators have these movements, but flexion, 3/4, extension, 3/4. Oh, sorry, this would actually be in the bottom part. So I'm going to do a control copy and a control paste.
Yeah, so again, in Clinic Server, if you highlight something, if you want to move it to a different spot, you can't do the highlight and then right-click and copy and paste. You want to highlight it and then actually hit Control-C and Control-V on your keyboard.
So sorry, I did that nice and quick and just moved it down. So back up, observations, no bruising or swelling visible. Function or gait NA, I'm not going to bother with that since it's really not applicable. Accessory motion, just for ease, I'm going to say too irritable. If he's pretty acute, I'm likely not going to go in and do accessory motion testing. Resisted isometric, pain and weakness, all elbow and wrist movements on the right. I'm not going to do manual muscle testing, again, too irritable. Special tests, given that he's this acute, I'm not sure I would do any, but let's say I'm going to do a grip test and it's going to be 4 kilograms, I'm just going to say. Palpation, tender, lateral, right elbow. I'm not going to worry about comments. In terms of neurotesting, again, in this particular patient, I wouldn't bother with this. They're too acute, but you could indicate normal upper extremity, as I could just say as above, normal upper extremities, same thing as above, and those are not tested. Neurodynamics I wouldn't do, again. And then I'm going to flip over to the analysis tab. So let's say that he has, it's not a contusion. It's hard to make up something for an alligator. Elbow, let's say he has sprain, I don't know. I'm going to say he's got a strain of right. It's crazy when the anatomy is stuck in my brain as an alligator and I don't have a reference. So strained right elbow, contusion, lateral side. Any clinical concerns? This was relevant for some of the reporting, so you could just leave that. Goal setting, we want full ARM within 2 weeks. Return to, I think I said he liked tennis. Mm-hmm. Return to tennis times 6 weeks. Pain-free, resisted isometric times 4 weeks.
Yeah, and like Paulette mentioned, if you see anything that does have that double asterisk in front, that's something that we are planning on developing into the progress and initial assessment and discharge reports that we do want to have auto-generate. Just with some other things, we haven't been able to develop those auto-generating reports yet. So if you fill anything in any of those double asterisks fields, it's not going to generate into any report at this time.
For now, yeah. So in this case, I would say we do a quick dash and then put in the number there, whatever it is. And then if I decided to do an outcome measure that's not in this list, which I'd be surprised if we were doing one, but if there was, you're certainly welcome to put the details in the text box at the bottom. And this will, for those of you who are in an Ontario OHIP setting, eventually this will allow us to track our outcome measure data, which will be great to not have to do it through the DAL. Okay, treatment, precautions. I don't have anything specific that I wanted to write, but let's say, for example, you had somebody who had a pacemaker, then you could write in here, pacemaker, no electrotherapeutic modalities, or they're a total hip, you don't want flexion past 90. You could indicate that here, which I think is very helpful. These areas automatically check off, saying that you've educated the patient about their diagnosis, you've discussed the management, as well as the risks and benefits of treatment, and that they may be dealing or working with some of our other teammates, whether it's PSPs, and so it auto checks, which is great. If I did any treatment today, education rice, gentle, ARM, exercise all directions, 10 times each, 3 times daily. Pain-free range. So that's what I did today. In terms of future plans, certainly I'm going to suggest that we do AROM, PRM, right elbow, all directions, exercises. Actually, sorry, this wouldn't even be in there. I'm going to put it in here. Gentle, resisted isometric, elbow, whoops, wrist, arm erg. I'm trying to picture what it would be doing in a clinic. If I go over to modalities, he's pretty acute. I might want to try some IFC, 80, whoops. Hit the wrong key, 80 to 150. I'm going to do 15 minutes. Quad, right elbow. Not going to do acupuncture. Education, about return to tennis and activities to avoid for now. So you get the idea. I'm pretty much going to put in here anything that I would normally in a chart note, and we certainly want to meet college standards. This is just a quick snapshot. You may need more parameters and more details, so that if anybody could step in and treat your patient, they'd be able to do so just by looking at the notes. In terms of treatment frequency, I'm going to suggest that he comes in 3 times a week. Treatment duration, in his case, I think I had said in my goals I wanted him back to tennis in 6 weeks, so I'm going to say 6 weeks. And I'd like to reassess in 3 just to see how he's doing. This, in order to rule out section, was really, as you can see with the double asterisk, that was for the assessment report going to the doc. So as of right now, if I don't have anything, I can leave that blank. If I want to refer to any of my teammates, for example, I think Lewis would be great with an OT. I don't have one in my clinic, but if I did, certainly that would be a great referral. And if there's somebody else that you wanted to include, you can check off multiple text box here is fine. If you had something specific that wasn't captured previously, you could put that in the bottom here as well. So once I've gone through each of them, if I wanted to complete just one tab at a time, I could do so by completing, by checking off this box here at the top. Otherwise, if I've completed the whole note, I would want to check the All Forms Complete button at the top. It is very close to the X, so you need to make sure that you're clicking the right one. I did hear from a couple people that they got tired at the end of the day and went to the top right and clicked before they realized, and of course at that point you will have lost data. So I'm going to do All Forms Complete. You'll see that they go gray, which means I can no longer edit. So if I wanted to do anything, if I needed to go back and change something I'd forgotten, I would need to create another one and list it as an addendum to this date.
Perfect. So yeah, once you do All Forms Complete, be sure to hit OK. You don't want to cancel out or exit that. And now I can see that the appointment is updated with this black F here. So I'm going to go on to his next date here and create another note. So this is going to be his first treatment after his assessment. So if I say duplicate last date, it's going to duplicate that assessment form, and I don't want to be filling that out on a daily basis. So I'm going to say add, and it's going to pull up the SOAP note. So I have him up here, and we're gonna go through this pretty quickly here. So I can start writing. If you want to actually view what was in his note before, again, you can just click OK and close out. The red F is gonna appear on his schedule. We already have Lewis open on the right hand or on the left hand side because we're in practitioner view. So if you go under his record and his PoC form entries, I'm just gonna reload this so it will take what's happened before. You can actually highlight the notes that you want to view at the same time, right click and select edit. So you can see my treatment, I can't make any changes because I've already completed the note, it's marked as complete, but my SOAP note I can make changes to still. So if you want to go ahead and just like copy and paste things over, so you want to bring that and, sorry, I put it, I didn't have it there, put it in whichever fields. I know that wouldn't go in there, but you can do that, and then the provided date will auto-populate there. And just fill in your note like that, then it's just a quick way to go through and do that rather than having to retype everything, and just a quick reference to be able to see that note open just on the next tab over. So that's pretty handy to do. Again, this progress note section isn't really pertinent right now because it's not auto-generating progress notes, and then this discharge section is also isn't auto-generating a discharge note. But for any outcome measures, it's still a great place to fill in an outcome measure if you're doing like a reassessment of the patient or the discharge for it. Okay, so I'm just going to complete this note and go ahead and click OK. So now that it's completed, my black F is there. Again, you just need to reload it to get it to show here. And now the next appointment that I have, if I go into my attachments, I can duplicate last date, and it's going to just duplicate that last date that we had, so you won't need to fill in the client name or date of birth if you filled it in before. So that's pretty handy. I'm just going to go down here and show another example. So in our Evangeline Firefly, I'm going to go ahead and duplicate last note, and again I'm in Princess Tiana, so a physiotherapist schedule, and I can see it duplicates from the massage therapy note. So right now Clinic Server is generating from the last note that was created, whether it was by a massage therapist or a physiotherapist. So again, you can right click View Client Folder, and it's going to bring up the patient folder on the left hand side, and you can see her name here, so that's how you know you're in the right folder. So I can see her note here, so you can actually right click and copy it directly from here, and then go into her attachments and paste the note, and now I have it opening up as my past note that I did, or that the physiotherapist has done on it. So you can go ahead and chart on the physiotherapy note, and the same thing for the massage therapist. If you're going to chart and the physiotherapist was the last person to see the patient, then you can do that to be able to quickly get your note back. Okay, so I'm just going to quickly, we're right at 4:30 now, so I'm just going to jump back into our live system and show you guys a way that you can pull up past chart notes and see which ones have been completed and incomplete and everything. So if you go onto your management tab under the appointments section, you're able to pick under this form type. You can see if you want to look for a specific part of a note. So if you want to see like a treatment note from the assessment page, or if you just want to see all notes and see what is incomplete, then you can set it to that, and then you can use these quick buttons here if you want to go and look at your month to date, and maybe you just want to change it back to yesterday's date since you're not going to necessarily have all of your notes completed, and then you can select go, and it's going to run a report to show you all of the incomplete notes from there. So you can see that there's 2 patients that still have an incomplete note, kind of highlight to those therapists to go and complete that, and then you can also check off the complete button, so we can do that, and it's going to run a report. So you can do it on a daily basis, you can do it on a weekly basis, or I could do month to date and do that on a monthly basis. So I can see at Trafalgar they've completed 78 chart notes up until yesterday's date, or up until today's date, sorry, 98 chart notes up until today's date. I just changed my month to date again, and again, if you want to do it till yesterday's date, I think that's where we got the 71 number from before, 78 number. So that's a great way to kind of follow up to see how the charting is going. If you want to look for a specific therapist, you can also, if you're maybe looking to see how you've done with your notes, you can select your name from the drop down here, and then it's going to highlight only your notes. So you can make sure that you've completed everything that you've wanted to, or see what's incomplete. And you can also go into your attachments window again here, and then open up your note that you've completed if you wanted to reference something from it. So there is that ability to do that. And again, that was management and appointments. So it's a pretty handy report to be able to pull, and then you can sort by client name if you're looking for a specific patient, and things like that. So it's helpful to be able to go in and see that. So it doesn't look like any questions have popped up yet so far, so that's great. If you do think of any questions, you can give us a call or an email at Clinic Server Support, and we can help you with that. And like I said, we are going to be recording this and posting this to the training center, so you'll be able to get the information on there as well. And there's actually just a question in here about PT and PSP charting and how to indicate who does what, so I'm going to hand that to Paulette to answer.
For sure, especially compared to people who have used Chartworks Clinic previously, where you can just select from a drop-down who delivered what part of the treatment, and that functionality is not yet in Clinic Server. You need to indicate if someone other than the person charting performed a section of the treatment. So if you work in a hybrid and the physio did some mobilization to a joint and the PSP ran the exercise program and did some IFC, you need to actually put that in your treatment plan. So I know I wouldn't actually write just IFC and exercise, but just for example, you would put something like that, and then I know I wouldn't just write modes again, but it would be the physio John Doe PT, so that if anybody, if the chart got audited, for example, we would know exactly who performed what task.
Perfect. So great. I'm just going to complete that again to show the black F on there. And then one last thing, just about charting with a PT and a PSP, or a PT and a massage therapist, or anyone who's sharing a computer to do the charting. It's always going to note who last modified it here. So right now I'm logged in under Princess Tiana, and I can see that by looking up here. So if you can be logged in with multiple instances on one computer, but always before charting or doing anything in the system, make sure you check up here on this top bar to make sure you're logged in under your own user. So I can see I'm logged in under Princess Tiana there, and then if I go over to my own here, I can see I'm logged in under my own. So just always double check that you're working under your own session if working with multiple people on one computer. Okay, perfect. So it doesn't look like any other questions have come in. We hope that that was helpful for you, and we are going to be doing some more clinician-specific training sessions in our learning series in the coming weeks. We do want to do one on compensation. We haven't set the date for that one yet, but so some things like that, and any other sessions, you guys are more than welcome to sign up for those. So we hope that that was helpful. And again, any questions, just give us a call or an email, and thanks to Paulette for going through and showing that charting part of it. So thanks, guys, and have a good day.
Thanks, guys.